Which cranial nerve is responsible for the sense of smell? Option A, optic nerve, B, olfactory, C, vagus, and D, facial. So, B, olfactory nerve is correct. Next, anatomy and physiology. Number 2. The master gland of the endocrine system is the option A, thyroid gland, B, adrenal gland, C, pituitary gland, and D, pancreas. So, C, pituitary gland is correct. Next, sociology. A social group toward which a member feels respect and loyalty is known as a out-group, in-group, reference group, or peer group. So the correct is in-group. Psychology. In Pavlov's experiment, the dog's salivation to the bell is an example of a conditioned response, unconditioned response, conditioned stimulus, and unconditioned stimulus. So the correct is A, conditioned response. Then microbiology. The gel Nelson stain is used to identify which type of bacteria. A, gram-positive bacteria, B, gram-negative, C, acid-first, and D, spirochetes. So, the C, acid-first bacilli is correct. Next, 6. Pathology. An abnormal widespread clotting cascade throughout the body is known as A, thrombocytopenia, B, hemophilia, C, disseminated intravascular coagulation, and D, anemia. So, C, disseminated intravascular coagulation is correct. Next, 7. Pharmacology. Which class of drugs is used to treat high blood pressure by relaxing blood vessels? A, diuretics, B, beta blockers, C, ACE inhibitors, and D, vasodilators. So the D, vasodilators is correct. Next, genetics. An individual having two identical alleles for a particular trait is described as A, heterozygous, B, homozygous, C, dominant, or D, recessive. So the B, homozygous is correct. Next, administration. SWOT, analysis in management, stands for A, strategy, work, opportunity, threat, B, strengths, weakness, opportunities, threats, C, system, workflow, outcome, target, and D, service, willingness, objective, teamwork. So the B, strength, weakness, opportunities, threats is correct. Next, 10. Education. The process of assessing or judging the value of a teaching program is called option A, measurement, B, assessment, C, evaluation, or D, testing. So the C, evaluation is correct. Next, 11. Research and statistics. A research study that looks backward in time is known as a prospective study, B, retrospective study, C, longitudinal study, and D, cross-sectional study. So the B, retrospective study is correct. Next, 12. Anatomy and physiology. Where does the gas exchange of oxygen and carbon dioxide occur in the lungs? A, bronchi, B, trachea, C, alveoli, and D, pharynx. C, alveoli is correct. Next, microbiology. Which of the following disease is caused by a virus? Option A, cholera, B, tetanus, C, poliomyelitis, and D, syphilis. So the C, poliomyelitis is correct, and others are caused by the virus. We all know that. Next, 14. Pharmacology. What is the antagonist for an overdose of opioids like morphine? A, protamine sulfate, B, vitamin K, C, naloxone, and D, flumazenil. So the C, naloxone is correct. 15. Psychology. According to erection stages of development, what is the primary conflict for adolescent? Option A, trust versus mistrust. B, initiative versus guilt. C, industry versus inferiority. And D, identity versus role confusion. So the D is correct. Next, pathology. The term metastasis refers to A, the beginning of cancer, B, the spread of cancer to other parts of the body, C, a benign tumor, and D, the shrinkage of a tumor. So the correct answer will be the spread of cancer to other parts of the body. Next, 17, genetics. Which of these is a sex-linked genetic disorder? A, cystic fibrosis, B, sickle cell anemia, C, hemophilia, and D, Huntington's disease. So the C, hemophilia is correct. Number 18, administration. The first step in the nursing process is A, planning, B, diagnosis, C, assessment, and D, implementation. So the correct answer is the assessment. 19, education. Which teaching method is most effective for teaching a practical skill like wound dressing? A, lecture, B, group discussion, C, demonstration, and D, reading assignment. So the C, demonstration is correct. Next, 20, research and statistics. In a blind study, who is unaware of the treatment allocation? A, only the researcher, B, only the participant, C, both the researcher and the participant, and D, neither the researcher nor the participant. So the correct answer is the C, both the researcher and the participant. Next, part B. 21, foundation of nursing. What is the normal range for an adult's respiratory rate per minute? A, 8 to 12 breaths, B, 12 to 20 breaths, C, 22 to 28 breaths, and D, 30 to 40 breaths. So we all know that the B correct answer. 22, foundation of nursing. Bed sores are also known as option A, pressure ulcer, B, edema, C, cellulitis, and D, contusion. A, pressure ulcer is the correct answer. 23, medical surgical nursing. A patient with liver cirrhosis may develop an accumulation of fluid in the abdominal cavity is known as option A, pleural effusion, B, ascites, C, edema, and D, anasarca. So the B, ascites is correct. Next, 24, medical surgical nursing. Which electrolyte imbalance is a major concern for a patient taking furosemide অর্থাৎ Lasix? Option A, hyperkalemia, B, hypokalemia, C, hypernatremia, and D, hyponatremia. So the correct is hypokalemia. 25, pediatric nursing. Apgar score is used to assess a newborn's condition. What does the A stand for? Option A, activity, B, appearance, C, attitude, and D, age. So the B, appearance is correct. 26, pediatric nursing. Cleft lip repair is typically performed at what age? A, at birth, B, 2 to 3 months, B, 6 to 9 months, and D, after 1 year. So the B, 2 to 3 months is correct. Next, 27, psychiatric nursing. A sensory perception without any external stimulus is a illusion, B, delusion, C, hallucination, and D, idea of reference. So the C, hallucination is correct. Next, 28, psychiatric nursing. Aversion therapy is based on which learning principle? A, operant conditioning, B, classical conditioning, C, observational learning, and D, cognitive learning. So the classical conditioning is correct. Next, 29, obstetrical nursing. What is Naegele's rule used to calculate A, fetal weight, B, estimated date of delivery, EDD, C, amniotic fluid index, and D, the gestation period. So the B, estimated date of delivery is correct. Next, 30, obstetrical nursing, a serious condition in pregnancy characterized by high blood pressure and protein in the urine, is option A, gestational diabetes, B, hyperemesis gravidarum, C, preeclampsia, and D, ectopic pregnancy. So the C, preeclampsia is correct. Next, 31, community health nursing. The pulse polio immunization program in India aims to eradicate A, measles, B, tetanus, C, poliomyelitis, and D, diphtheria. So the C, poliomyelitis is correct. Next, 32, community health nursing. Which of the following is a waterborne disease? Option A, tuberculosis, option B, malaria, option C, typhoid, and option D, COVID-19. So the C, typhoid is correct answer. Next, 33, medical surgical nursing. What is the priority nursing assessment for a patient with a head injury? Option A, pupillary response, option B, blood pressure, C, heart rate, and D, temperature. Option A, pupillary response is correct. Next, 34. The true pelvis is separated from the false pelvis by the option A, ischial spine, B, pelvic brim, C, sacral promontory, and D, symphysis pubis. So the option B, pelvic brim is correct. Next, 35, pediatric nursing. A green stick fracture is most commonly seen in which population? Option A, elderly, adults, B, adolescents, C, children, and D, athletes. So the C, children is correct. Next, 36, psychiatric nursing. Wernicke-Korsakoff syndrome is a neurological disorder caused by a deficiency of which vitamin? Option A, vitamin B12, cobalamin, B, vitamin B6, pyridoxine, C, vitamin B1, thiamine, and the C and the D, vitamin C, ascorbic acid. So the option C, vitamin B1, thiamine is correct. Next, 37, community health nursing. The Anganwadi worker is a part of which national program? Option A, National Health Mission, B, Integrated Child Development Services, C, Janani Surakha Yojana, and D, Swachh Bharat Abhiyan. So the B, Integrated Child Development Services is correct. Next, 38, foundation of nursing. Which route of medication administration has the fastest onset of action? A, oral, B, intramuscular, C, subcutaneous, and D, intravenous. So the D, intravenous is correct. Next, 39, medical surgical nursing. A patient is scheduled for a cholecystectomy. This procedure involves the removal of the option A, kidney, B, spleen, C, gallbladder, and D, the appendix. So the C, gallbladder is correct. Next, 40, obstetrical nursing. What does a positive Chadwick sign, a probable sign of pregnancy, indicate? A, softening of the cervix, B, bluish discoloration of the cervix and the vagina, C, fetal heart sound, and D, fetal movement felt by the mother. So the B, bluish discoloration of the cervix and vagina is correct. Next, pediatric nursing. Failure of the neural tube to close during embryonic development can lead to option A, Down syndrome, B, cerebral palsy, C, spina bifida, and D, hydrocephalus. So the C, spina bifida is correct. Next, 42, psychiatric nursing. A patient who repeatedly performs ritualistic behaviors to reduce anxiety is likely suffering from option A, generalized anxiety disorder, B, panic disorder, C, OCD, obsessive compulsive disorder, and the D, post traumatic stress disorder. So the option C is correct. Next, 43, community health nursing. Secondary prevention of disease focuses on option A, health promotion, B, early diagnosis and prompt treatment, C, disability limitation, and the D, rehabilitation. So the B is correct answer. 44, foundation of nursing. To prevent needle stick injuries, a nurse should option A, recap the needle using two hands, B, never recap a used needle, C, bend the needle before disposal, and D, leave the needle on the bedside table. So the B is the correct. Next 45, medical surgical nursing. Which finding is characteristic of Cushing syndrome? Option A, weight loss; B, hypotension; C, moon face and buffalo ham; and the D, dehydration. So the C is correct answer. 46, obstetrical nursing. Apgar score is assessed at what times after birth? Option A, 1 minute and 5 minutes; B, 5 minutes and 10 minutes; C, immediately and after 30 minutes; D, 10 minutes and 20 minutes. So the option A is correct. Next 47, what is the most common food allergy in young children? A, peanuts; B, soy; C, cow's milk; and D, shellfish. So the option C is correct. Next 48, psychiatric nursing. The primary goal of crisis intervention is to: option A, provide long term psychotherapy; B, resolve the immediate crisis and restore functioning; C, prescribe appropriate medication; and D, diagnose a mental illness. So the B is correct answer. 49, which committee is known as the Health Survey and Development Committee? Option A, Vore; option B, Mudaliar; option C, Carter Singh; and D, Srivastav Committee. So the option A, Vore Committee is the correct answer. 50, foundation of nursing. The ideal angle for an intramuscular injection is: option A, 15; option B, 45; option C, 90; and option D, 120 degrees. So the option C, 90 degree is the correct answer.